Assalamu alaikum. If you suffer from high blood pressure, then you're going to want to watch today's video. Today we're going to be talking about the DASH diet. The acronym DASH stands for Dietary Approaches to Stop Hypertension. As its name implies, the DASH diet was developed by the National Institute of Health to help treat or prevent high blood pressure or hypertension without medication. The diet was created after researchers noticed that high blood pressure was much less common in people who followed a plant-based diet, such as vegans and vegetarians. It's rich in fruits, vegetables, and lean proteins, and it restricts red meat, salt, added sugars, and fat. It's not meant to be a temporary fix, but rather a lifelong approach to healthy eating. I cannot endorse the DASH diet enough. It's been recommended by the Mayo Clinic, the American Heart Association, the American College of Cardiology, the Dietary Guidelines for Americans, the U.S. Guidelines for the Treatment of Hypertension, and the National Heart, Lung, and Blood Institute, which is a part of the National Institutes of Health of the U.S. Department of Health and Human Services. The DASH diet encourages you to reduce the sodium in your diet and eat a variety of foods which are rich in nutrients, such as potassium, calcium, and magnesium, protein, and fiber. These nutrients are crucial to lowering high blood pressure, and they reduce the risk of heart disease. You don't have to track each one of these nutrients specifically. You just need to focus on consuming healthy foods like vegetables, fruits, and low-fat dairy, eat moderate amounts of whole grains, fish, poultry, and nuts, and limit foods that are high in saturated fat, such as fatty meats, full-fat dairy, tropical oils, and sugar-sweetened beverages and sweets. Correcting the sodium-potassium balance in your body can help improve your blood pressure. In just 2 weeks, the DASH diet may be able to reduce your blood pressure by a few points. Over time, your blood pressure could drop by 8 to 14 points, which can make a significant difference in your overall health risks. Interestingly, people on the DASH diet still experience lower blood pressure even if they don't lose weight or restrict salt. The DASH diet lowers blood pressure not only in people with high blood pressure, but also, to a lesser degree, people with normal blood pressure will have their blood pressure lowered to an even healthier level. The DASH diet, being a healthy way of eating, offers enormous health benefits beyond just lowering blood pressure. It may aid weight loss. Given that the DASH diet cuts out a lot of high-fat, sugary foods, people may find that they automatically reduce their calorie intake and lose weight, although other people may have to consciously restrict their intake. It can help prevent osteoporosis and decrease risk of some cancers, including colorectal and breast cancer. It decreases heart disease risk and lowers risk of stroke. It lowers diabetes risk and improves insulin resistance. It lowers metabolic syndrome risk. Some studies note that the DASH diet reduces your risk of metabolic syndrome by up to 81%. Many of these protective effects are attributed to the diet's high fruit and vegetable content. In general, eating more fruits and vegetables can help reduce risk of disease. There are 2 versions of the DASH diet. The standard DASH diet, where you reduce your sodium intake to 2,300 milligrams of sodium a day, which is about a teaspoon of salt. This is a good starting point, but you should aim to eventually follow the lower sodium DASH diet, where you consume a maximum of 1,500 milligrams of sodium a day, which equates to about 2/3 of a teaspoon of salt. The American Heart Association recommends 1,500 milligrams a day of sodium as an upper limit for all adults. Note that the effect of salt on blood pressure is not that clear. Some people are salt sensitive, meaning that salt exerts a greater influence on their blood pressure than on other people. The comprehensive salt restriction as advised on the DASH diet may only be beneficial for those people who are salt sensitive or who have high blood pressure. Also bear in mind that the salt you add directly to your food comprises only a small portion of your daily salt intake. Processed and refined foods contain a far greater amount of salt, which is disguised and may not be apparent to your taste buds. You should always take the time to read food labels to learn how much salt you're really consuming. Both versions of the DASH diet include lots of whole grains, fruits and vegetables, low-fat dairy products. They also include some fish, poultry, and legumes, and encourage a small amount of nuts and seeds a few times a week. Although the DASH diet is low in saturated fat, trans fat, and total fat, you're still allowed small amounts of red meat, sweets, and fats. On the other hand, if you're a vegetarian, the DASH diet offers you alternative food choices so that you can follow your plan. The DASH diet guides you towards healthier food choices, and you can customize your plan to lose weight, maintain weight, or even gain weight. The National Heart, Lung, and Blood Institute, which helped develop the DASH diet, publishes free guides on the plan. These guides are absolutely free. You'll find the links to these guides in the description box, so if you're interested in following the DASH diet, you can go and download them right away for free. One PDF is 20 pages, while another is an abridged PDF version of only 6 pages. Both take you through the same process of determining how many calories you should eat for your age and activity level, and they tell you where those calories should come from, and they remind you to go easy on the salt. The National Heart, Lung, and Blood Institute also offers more than 180 heart-healthy recipes in its online database. A lot of other reputable organizations like the Mayo Clinic also provide long lists of DASH-friendly recipes. If you're trying to lose weight, you will need to eat fewer calories and adjust your serving goals based on your individual circumstances. However, if you're aiming to lower your blood pressure, the DASH diet generally incorporates about 2,000 calories a day. In my next video on the DASH diet, I'll tell you exactly what to consume from each food group to follow the DASH diet, and I'll give you some tips that will help you follow your plan. Don't forget to download your free DASH diet guides from the links I provide you with below, and hit like and subscribe to the channel so you don't miss any of my tips and advice. And Assalamu alaikum.